I'm Carol and welcome to Greenwood Therapies. This is a little run of exercises for a stiff neck. A lot of the clients that come to me are hoping that I'm going to fix them in one session. Sadly, it never really works like that. We need you to do the homework too. But it's okay, it doesn't hurt. So, first one we're going to do is really, really simple and really important, particularly if you're a driver. If you drive a car and you can't turn your head to check behind you, there is a limit to how much you can use your body to turn. And it could be that your insurance is null and void. It's worth thinking about. So having a free and easy neck isn't just more comfortable, it's actually more legally road safe. So the first thing we do is remember that with every move that we make, we have to go slowly and within comfort. By all means, in a move, you can go and you can touch discomfort, but I don't want you to stay there. And if you've gone into pain, we've really moved too fast. So slow and within comfort. So the first, to begin with, you imagine that there is a shelf and your head's sticking out through the middle of it. And all we do, making sure that we're not moving our head side to side, so almost as if there's a rod attaching through to our spine so that we can't tilt or sideways move. You just turn your head very slowly, comfortably, and see how far you can go. Now this could be it, or maybe you're rather luckier and do exercises more often, and you can get to the full scope where your head and chin is over the shoulder. If you can get this far, you're doing great. But maintain the exercises, keep practicing, because otherwise you might lose it. However, if you can only get so far, the trick is make sure you're comfortable enough, because you're going to just sit there and just wait. No expectation, no pressure, definitely no pain or discomfort. Just waiting. Perhaps do this in the evening where you can sit watching television and just alter your body so your head is turned to the telly to help you sit and wait. After, say, a minute, which I think is probably what we've done now, just see if you can turn it a little bit more. In most cases, if there's no structural issue preventing movement, if it's purely the soft tissue, the muscles, leaving that weight without stress or expectation will allow the tissues to soften and relax and stretch a little bit more. So maybe after another minute, you can go a little bit further again. Once you've reached a point where you are content that this is good enough for you today, a nice big, deep, slow breath. Make sure you watch my video on good breathing. And then slowly back to center. Breath to stabilize and to rebalance. And try the other side. And you'll be doing exactly the same thing. Seeing how far, how comfortable you can go. If you reach an end point, sit and wait. Quite happy, quite comfortable. My body is quite relaxed. No expectation, no push. And then we can turn the rest of the way. Breath once we've got to as far as we wish to, a conscious releasing breath, and then back to center. Turning your head side to side isn't full neck movement. So another one that is important is the head tilt. And you can see how far, how close you can get your ear down to your shoulder. Now be aware, don't let your shoulder come up, And another trick is to tip the body. Not very helpful. Keeping shoulders level, relaxed, and in a comfortable position. Head over, not bringing head forward or back, until you can feel a stretch, which is usually pretty much around the back of the neck for most people. But see, when you can feel a stretch, not uncomfortable, definitely not painful, just you can feel it. And then we want to see if we can bring this around to release all the way. So once you're in that angle, look up to the corner. Now for me, this now comes round more this way. Nice relaxed breath, face back to the front, and then head upright. It's really important to do these in the right order, because if you do them in the wrong order, you can end up, you're taking your discs, your vertebrae, you're tilting them, and the disc is going to be slightly more squeezed on one side than the other. Now in normal healthy movements, so long as there isn't structural issues, this doesn't cause a problem. But what could do is if you start turning your head at this angle, because you end up slicing. So I'm going to demonstrate it to you once what not to do, so make sure you don't. And that is, I can't even think what it is now, going to the corner and then doing this too often. And so it's over to the corner, feel that release. I'm tighter on this side today. Deep breath, back to front, and then up. So it's 2 exercises. But again, this is not a full range of movement. So another nice one to do is looking down at the ground and up at the sky. So again, comfortable position. Soft, easy breath to start. Let your body settle into it. Keeping your spine nice and long, shoulders down. Just looking down, nice and slowly. A lot of people can't get much further than this, so just sit with it and allow. And after a minute, just notice, can your head come lower? And for me, I can get quite good flexion, I think. So this is as far as my neck wants to go today at the moment, but let's wait a moment. I can feel the stretch in my back. It's coming down to about here at the moment. I'd like to get down to a little bit lower. Oh yeah, there we go, we've loosened off a bit more. Relaxing breath, complete that move, and come slowly up. Now when you're coming up, you don't want to bend like this. You want to bend your neck kind of round, one vertebrae at a time, to open up the space between all the vertebrae. So it's not just a straight down and a straight up. It's a curling down and a curling up. If you play with your movement, you'll know when it feels right, because it feels like you are curling down rather than just going straight over. And then of course we need to do the opposite direction. Comfortable breath to start. And just reach up. Now one of the things we're aiming for is to really lengthen the space all the way down your sternum. And if you were standing, you could actually improve this to help lengthen out the psoas, the deep stomach muscles, which often get tight when we are sitting in a car, over a desk, or even just feeling stressed, that you may not even notice the stress level because it's normal. But that kind of stress level leads to this closing in of posture. So this is helpful to open it up. So we look up, and then we lift our jaw to the sky too. So a little bit of pulling faces at the sky. And as I'm leaning my head back, I'm keeping my body upright. If you've got problems, sit in an backed chair, and then you don't end up just leaning back. Comfortable breath when you feel that you've gone as far as you wish to, and bring your head back again. So that's 3 little exercises which you can do anytime, especially if you feel that your neck is feeling a little bit tight.